soaring high and making difference, where we talk anything about nursing. So let your voice be heard right here. Moments with Professor X.
Good afternoon, Las Vegas. How's everybody? It's me again, Sander. Today is actually July 16, 2025. My God! Ang bilis ng panahon. Good morning, Philippines. I know it's almost 8 o'clock in the Philippines. And every time I do Facebook Live, I usually discuss a common NCLEX concept. By the way, hello to my friend Gift Paguntalan, CEO of Aim to Top Review Center. So if you have any plans to do your review for any qualifying examination for nurses, midwifery, agriculture, what else, Sir Gift? Teachers, please reach out to Sir Gift Paguntalan, the owner of the largest and the most trusted review center in Visayas and Mindanao, Aim to Top Review Center. Big shout out to all senior lecturers of Aim to Top. I miss you guys. How are you, Sir Gift? Nakakaloka. Kumusta ka dyan? I know it's 8 o'clock. I wonder, why are you so up this hour? I know usually gising ka ng mga almost 10 o'clock. Why is it by this hour at 8 o'clock, it's too early for you to wake up this time? How are you, Sir Gift? Ha? May ginawa ka namang kalokohan, ano? Anyway, let me check. I have to make sure I'm also streaming to other platforms. Give me a few minutes. Okay, good. So anyway, we will talk about what do you call this? We will talk about cardiac catheterization today. Okay. By the way, hello and thanks for watching, Jaran Alvarez, Christy Jane Peñalosa Waminal. Thanks for watching. Who's this? Honey boy, how are you? And of course, one more thing. Big shout out to my good friend Mardon Pasco. I heard Mardon Pasco is really good. He's doing well. Am I right, Sir Gift? Oh my God, baka ano pang masabi ko dito? So let's move forward. Let me share my screen and we'll talk about cardiac catheterization. Okay, so let's talk about cardiac cath. Your cardiac catheterization is another common concept or common question in your what do you call this, state board exam. Okay, so if you encounter that has something to do with your cardiac cath, usually ang mga tinatanong dito, prioritization, your responsibilities before the procedure, what nurses should do after the procedure, and what to watch out for. Okay, so that will be the focus of our topic this afternoon or this morning, wherever you are. Okay, speaking of wherever you are, sorry, I will be in London, UK next week, July 23 till July 31st. So sa mga students ko dyan na nasa London, UK, I hope to see you. Let's go somewhere else. I want to go to Stonehenge. I want to visit the, what do you call that? I want to visit, saan yun? I know that Stonehenge is far from London, so we will be going there. and then I want to see the big eye and a lot of stuff. So if you're in London, UK, I'll be there next week, and I hope to see you. Oh, Tony Boy De Vera, how are you? Thanks for watching, and hello to Krishna May Igasan Abdullah Casino. How about the pangalan nito? It's very mouthful. Anyway, so your cardiac catheterization is a minimally invasive procedure wherein the doctor inserts a catheter and the doctor threads the catheter directly into the heart. And why doctors do this for two common reasons. First, they do this for diagnostic quality, for diagnosing patient. And the second reason why they do this is to treat underlying problem. Okay, so let's say the patient is known to have coronary artery disease and there is an occlusion in the coronary artery. Your cardiac catheterization will be done in order to improve the flow of blood to the heart. Okay, so your cardiac catheterization, I said the doctor threads a catheter into the blood vessel of the heart, the coronary artery. So for the purpose of diagnosing patients, so diagnosis, okay, or for the purpose of treating patient, so let's say that treatment, okay. Now, one good example of cardiac catheterization for diagnosing patient is a term called coronary angiogram. Okay, your angiogram. So take note in your examination, the moment you will encounter the word angiogram, so it involves the blood vessel, and most often the doctor inserts or administers a contrast or dye. Okay, and that contrast or dye will reflect the vascular compartment. Okay, now since it involves administration or contrast, thing to remember in your examination here is that contrast or dye are usually nephrotoxic. That is why if a procedure entails using of a contrast or dye, make sure that the urinary output of the patient is good, that the BUN creatinine level, the potassium level of the patient is within the normal limits, okay? And your patient has good kidney functioning. So how will you know good kidney functioning? Of course, the urinary output, levels of the BUN creatinine, levels of the potassium, okay? So those are parameters that will reflect kidney functioning. Remember, contrast or dye can cause kidney injury. So the more it causes damage to the kidneys, causing renal failure. Oh, is this? Thanks for watching, my Robin Zuben. I hope I said your name right. Sean Rodriguez. Hey, how are you? And hello to Neil Ganashas and Michael Agaspi. Hey, Mike, how are you? Now, that's your angiogram. And by the way, an angiogram can also be performed to your brain, and you call that as your cerebral angiogram. An angiogram can be performed to your lungs. You call that your pulmonary angiogram. An angiogram can also be performed to your heart. That's your coronary angiogram. Remember, regardless of the structure being evaluated, the principle behind it is the same. Okay, so the doctor will make a slit in an artery and insert or thread a catheter until such time it will reach the structure where you want to assess. And then the doctor will administer a contrast or dye. Okay? Different sites, but the principle will be the same. Okay, that's your angiogram. When you say treatment for the purpose of treatment, okay, one good example of your cardiac catheterization for treatment purposes is your PTCA. Now, what does PTCA stand for? PTCA stands for percutaneous transluminal coronary angioplasty. Okay, so it's different from angiogram. Angioplasty. So in your angioplasty, what do doctors do here is that, let's say that this is the coronary artery known to have an occlusion. What is good about your angiogram is that the doctor will be able to identify what specific part of the coronary artery has an occlusion. And the doctor will be able to identify what is the degree of occlusion or obstruction. How many percent of the blood vessel is occluded? Is it partially occluded? How many percent is it completely occluded? That's the good thing about angiogram. Now, let's say that the doctor was able to pin the specific site of your obstruction, and the doctor will correct that. So the doctor will do angioplasty. Sorry. So the doctor will do angioplasty. So in your angioplasty, same, the doctor will thread the catheter, and then the tip of the catheter has a balloon in it. So initially, the balloon is deflated, and the doctor will thread that deflated balloon tip catheter until such time it reaches the area with obstruction. Okay. So what will the doctor do now is that the doctor inflates the balloon, and what will happen is that as the balloon inflates, okay, as the balloon inflates, it compresses, okay, the obstruction and improving the normal circulatory flow, or it improves the normal circulation by compressing the clot, by compressing the fat deposition. Okay, so see, the purpose in doing the catheterization here is not for treatment purposes, but I mean, not for diagnostic purposes, but for treatment reason. Okay, now, and sometimes not only a balloon tip catheter is being placed, the doctor will also put a stent. So a stent is made up of a wire mesh, and then I dropped my stylus pen. So a stent is made up of a wire mesh enclosing the deflated balloon. So as the balloon inflates, okay, hold on. I want you to see me when I explain something. Okay, so this is the balloon tip catheter, and the balloon is deflated, and this is your wire mesh or stent. So as the balloon is inflated, it dilates or opens the stent, and the stent locks itself inside the blood vessel and dilates or opens the blood vessel of your patient. So that's your coronary stent. Okay. Now again, in general, we call that as your cardiac catheterization. Okay. Now I have an animation here, and then hopefully this will reinforce whatever or the things that I said. Okay. Hello to Richard Navarro. Hoy Bayong, kumusta? ¿Cómo estás? How are you? Okay, where's my cursor? Here. So this is your coronary angiogram with your coronary angioplasty. Okay. Okay, why is it not working?
Coronary angioplasty, also called percutaneous transluminal coronary angioplasty or balloon angioplasty, is designed to restore the flow of blood through coronary arteries narrowed or clogged by atherosclerotic plaques or blood clots. When you arrive at the hospital, an intravenous line will be started. You will be placed on a heart monitor, and you will be given an oral or intravenous sedative to help you relax. Most coronary angioplasty procedures last between 30 minutes and 3 hours. The doctor numbs the skin in your groin area and inserts a needle into your femoral artery. Once the needle is placed, a guide wire is passed through the needle and gently guided through the arterial system to the heart. The needle will be withdrawn and exchanged for a small flexible tube called a sheath, permitting access to your femoral artery. At this point, you will be given a blood thinner to reduce the risk of blood clots. Next, a soft, flexible catheter is slipped over the wire and threaded up to the heart. The procedure is monitored using a continuous X-ray imaging device called a fluoroscope. You may feel pressure as the wire and sheath are inserted through the groin and pushed through the artery, but you will not feel their movement inside your arteries. At this point, your doctor will remove the guide wire, position the tip of the catheter just inside the coronary artery to be treated, and inject a special dye. The dye allows the fluoroscope to take X-ray images, called angiograms, of the artery's interior. Any blockages will be clearly identified as the arteries fill with the dye. You may feel flushed or slightly nauseated when the dye is injected. Once the blockage is identified, your doctor will insert a flexible guide wire into the artery and advance a balloon-tipped catheter over this wire and into position at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, reestablishing blood flow through the artery. You may feel some chest pain while this is happening. The same procedure is repeated for each blockage being treated. Afterwards, your doctor will withdraw the deflated balloon and catheter from your arteries. Some patients will receive a coronary stent, which is a small tube made of wire mesh designed to prop open the artery once it has been treated. A collapsed stent is placed over the deflated balloon as it's moved into position. When the balloon is inflated, the stent expands and locks into place. After the balloon and catheter are withdrawn, the stent remains behind to hold the artery open permanently. After your procedure, a pressure bandage will be applied over the femoral artery to prevent bleeding. You will need to lie on your back for several hours, during which time you will be checked periodically for any signs of bleeding or chest pain. You may either be discharged home on the same day or after an overnight stay in the hospital.
Okay, so that is your coronary angiogram with coronary angioplasty. Okay, now this is your actual coronary angiogram. Okay. So look, so you will see the contrast or dye passing the blood vessel of your patient. So with your angiogram or your angiography, it will reflect the vascular compartment. So you'll be able to identify what artery is occluded and the degree of occlusion or obstruction. See, that's the beauty of your angiogram or angiography. So can you imagine if that is if this principle the same principle is being applied to your coronary angiogram, to your cerebral angiogram, to your pulmonary angiogram, so the doctor will be able to identify what specific blood vessel in the brain is occluded. Remember, coronary occlusion will result to heart attack. Cerebral occlusion will result to stroke. Okay? So good thing with the advancement of our technology. Now, anyway, let's go back to your NCLEX. Now, question, if your patient is scheduled for cardiac catheterization, what are the things you need to remember as a nurse? Remember, this is for your examination. Okay? So let's write it down. So here you have your cardiac catheterization. Remember, your cardiac catheterization is a minimally invasive procedure. That is why make sure that there is a doctor's order for this. Okay. So you have to check for the doctor's order. Okay. Not only check for the doctor's order, make sure you have also to check the consent. Now, question, who obtains the consent? We know it's very basic. Doctors will obtain the consent. Your responsibility as a nurse is to witness signing of the consent. Okay. Now, question, the moment that patient tells you, oh, I have a procedure to be done today, and that procedure is what do you call it? A procedure is insertion of a catheter here in my hand, and the doctor will administer an antibiotic. But you know that that is not the procedure to be done. The procedure is cardiac catheterization. So it means to say that the knowledge of the patient is incorrect. So what will you tell the okay, what will you do? Will you allow the procedure to be continued? No. You have to tell the doctor that the patient is not fully aware of the procedure. Okay? Because the patient is telling you a different procedure. So please don't forget that. Okay? That the patient fully understood the procedure, the consequences, the risks involved. Now, do we have a risk for this, even if it's a minimally invasive procedure? Yes. Remember this, regardless how minimally invasive the procedure is, there will always be risks involved. Now, what are possible complications of this procedure? Let's say if as the doctor threads the catheter, there is a risk that the doctor will be able to poke and perforate the coronary artery. That is a possibility. Okay. So bleeding will happen after that. So there's a lot of complications. Okay. So that is why it's very important for the doctor to explain the procedure, okay, why it needs to be done, what are the benefits of this procedure, and the complications associated with the procedure. Okay? So don't forget that. Next, number 3. Third thing to remember, Make sure that if your patient is scheduled for cardiac catheterization, you have to check for the patient's kidney function. Why? Remember, I said that in your coronary angiogram, doctors will use a contrast or dye, and this contrast or dye are known to be nephrotoxic. Not only that, you have also to check for allergies. Okay? Allergies towards iodine or your iodine because of your contrast or dye. Now, with your kidney functioning, what will you check? You check for the patient's urinary output. You check for the patient's BUN. You check for the patient's creatinine. Okay. And you check for the patient's potassium level. Remember, okay, a patient with renal dysfunction, just like your renal failure, they will have hyperkalemia. Okay. So these are parameters that will evaluate kidney functioning. Okay, what else? Number four, do not forget this. Okay, if your patient is scheduled for cardiac catheterization, you need to check peripheral, okay, peripheral pulses. Never forget this in your exam. This is a common question. Now, why do you have to check peripheral pulses, and when will you check peripheral pulses? You have to check peripheral pulses, or sometimes in NCLEX, they will use another term. They call this as distal pulses. That will be before the procedure and after the procedure. Okay. Remember, I said in your cardiac catheterization, in order for them to introduce or thread the catheter in to the patient's blood vessel, they will make a slit in an artery to gain access. So remember that with respect to your access, where is that? Hold on. I lost my monitor. There. Stop shares. Okay. Now, remember I said they need to have an access. So usually they may use radial artery, they may use subclavian, they may use femoral artery. Okay. So if your patient or not patient, if the doctor uses a femoral artery, make sure that you check your popliteal pulses, your dorsalis pedis, okay, your posterior tibialis pulse points. Remember, before the procedure, there must be pulses. After the procedure, there must be pulses. Absent pulses, okay, no pulses post procedure, that's not a good thing. Why? If there's no pulse after the procedure, it means to say there is no flow of blood. There is no circulation. Most likely, there's an injury in the artery during the procedure, and that obstructs the normal flow of blood. That is why there is no pulses. Patient has pulselessness. So what will you do as a nurse? You tell the doctor. Now, what about in your examination? It tells you weak pulse or a thready pulse post procedure. Is that okay? Yes, it is. Okay, so take note. Weak pulse, thready pulse is fine post cardiac catheterization. Take note, I am referring to your peripheral or distal pulses. Okay, but no pulse post procedure is not okay. Okay, I hope that is okay. That is clear. Okay, let's go back. Okay, so peripheral pulses. Next, number 5, post procedure. Post procedure. Post procedure, what are the things you need to remember? Letter A, positioning. What do you think is the best position post cardiac cath if the doctor uses the femoral line? Okay, what is the first answer and what is the second answer in your exam? The first answer is supine position, flat on bed. Okay, flat on bed. In the event that you cannot find supine position, it's okay to elevate the head off the bed, but take note, but not greater than 20 degrees. Okay? It's okay to elevate the head of the bed, but not greater than 20 degrees. Okay? Next, letter B. Post procedure. Okay? Post procedure, you need to apply direct pressure. apply. Okay, I need to erase this. You need to apply direct pressure over the site. Why will you apply direct pressure over the site? Remember, the blood vessel they use during this procedure is an artery. So there's always a risk of bleeding post procedure. That is why you need to apply direct pressure post procedure. So what we usually do, long time ago, we'll use a sandbag. We put a sandbag just above just above the surgical site to add pressure. Okay. Now we have a special strap. Sometimes we use a Velcro strap to apply direct pressure over the site. Okay. The purpose in doing or applying direct pressure is to control or prevent bleeding post procedure. Don't forget that. Next, letter C. Post cardiac catheterization or post coronary angiography. Take note, tell the patient to increase oral fluid intake. Question why? Why is it important for you to tell your patient, hey, you need to drink a lot of water? The purpose in drinking a lot of water is for the patient to pee a lot. Okay. Why is it important for the patient to urinate? In order to promote dye or contrast elimination. Okay. So take note, the reason in telling the patient to drink a lot of water is to promote dye or contrast elimination. So please don't forget that. And letter D, of course, post procedure, you have to watch out for bleeding. Okay. You have to watch out for chest pain. Okay. So these are things you need to remember when you talk about post open heart. Not open heart, post heart catheterization or cardiac catheterization. Okay. Do you have any questions? Anyway, who do we have here? Thanks for watching. Thanks for watching. RJ de la Victoria. Thanks for watching. Dandy Ledesma. Tina Baby loves you. Tari ng pangalan na to ah. Who else? Okay, hold on. Who else? Thanks for watching Sibel Baltazar. JC Garcia Bacleon. And Neil Zer, thanks for watching. And hello to Ivy Rose Somin Takimeno. Hello to my relative Elk Banares Olarte. And hello to J Bugs Madraps and Stella Marie. Okay, so that is what we call cardiac catheterization. So again, just to recap, your cardiac catheterization can be done for the purpose of diagnosing patient, just like your angiography, and can be done to treat patient, just like your angioplasty. Okay, so it's a minimally invasive procedure. We usually do this to patient with known or suspected coronary artery disease to check the degree of obstruction and what specific coronary artery is occluded or having. So I hope you learned something. Thank you so much. Hello, morning po from Ilyar Glico. Thanks for watching. If you have any questions, please drop a message. God bless everybody. Keep safe. Bye.